morning. As we begin a new year, we do so with a vaccine that will ultimately curb the spread of the virus and allow us to move about more safely. Restrictions put into place in 2020 were necessary to slow the spread and save lives, and we must continue with some of those restrictions until a vaccine is widely available later this year. As I've said from the beginning of this pandemic, we rely on science, on our public health experts, and our medical professionals to guide us. The health and the safety of all of our residents will always be the priority. As we regularly review our protocols to ensure they are appropriate for responding to the virus. As I mentioned last week, the Department of Health has worked closely with the core group of restaurant owners on new safety protocols for indoor dining. And because new COVID cases continue to fall in St. Louis County, the Health Department's new protocols will permit indoor dining to begin today. The Health Department and restaurant groups have agreed on a set of straightforward guidelines for indoor dining. They include 5 key changes. I highlighted these last week, but with the protocols going into place today, I want to repeat them this morning. First, occupancy at restaurants will be limited to 25% of the fire code capacity for the total number of diners sitting at tables spaced 6 feet apart, whichever is lower. Banquet facilities will also be limited in their occupancy to 25% or 50 people maximum. Second, new mask protocols will be in place to better protect our restaurant workers. All customers must wear a mask when entering and exiting the restaurant and when visiting the restroom. Customers also must wear a mask while interacting with restaurant employees, including when food or drinks are brought to the table. Third, restaurants and bars will be required to close by 10 p.m. Fourth, some bars will need to install physical barriers like plastic or plexiglass. And fifth, restaurants and bars will record the names and contact information for patrons to assist with contact tracing and case investigation if that proves to be necessary. There are more details available on these new Health Department guidelines at stlcorona.com. Click on the green Safety Guidelines button on the homepage. I want to thank all the restaurant owners and workers who have followed the existing protocols to keep their customers and their employees safe. This pandemic has been harder on the restaurant industry than on most, and the new restrictions allow restaurants to open their dining rooms and provide diners an opportunity to expand their support for our local businesses. It's important to emphasize that we're able to make this policy change because the numbers are going in the right direction. But it's also important for everyone to understand that indoor dining, even with these protocols, continues to pose substantial risks to patrons and employees alike. We work carefully to mitigate those risks as much as possible. And I want to thank the restaurant owners who worked with us and for all of their collaboration. Our public health experts are doing their best to craft policies that protect us all from a deadly virus. I hope that we can all join in supporting our local restaurants as they try to survive the pandemic in a way that is safe for their customers and for their workers. With 2021 underway, let's stay on the safe path forward so we can continue to rebuild our economy and keep everyone healthy. And I'd be glad to take any questions.
Yeah, Dr. Page, I have a few. You're requiring restaurants to take down people's private information for contact tracing, with no way to ensure that it is protected. If someone doesn't have a cell phone or email, does that mean that they're going to be denied service?
So the question surrounds generally collecting information from patrons so that restaurants and public health workers can contact them if they've been exposed. We're asking restaurants to do what we've seen in other jurisdictions across the state or across the country, to provide a way for us to contact and for restaurants to help us contact anyone who might have been exposed. We're asking our restaurants to collect a cell phone number or an email or some other way to contact individuals and to keep that information for up to 2 weeks so individuals can be contacted. This was a recommendation of our restaurant work group and our public health department. The information, if it is determined that the health department needs that information would be covered by HIPAA and would be protected under federal law.
The county's been asking individuals to handle their own contact tracing because of the high case numbers there's a positive case connected to a restaurant, does it fall on the restaurant to contact the patron?
Yeah, so the question is about contact tracing and who contacts patrons. Historically in St. Louis County, restaurants have contacted some patrons on their own. The cooperation between the restaurant working group, restaurants in general, and our public health department is extraordinary, and I expect that cooperation to continue. Since the cases are starting to fall in St. Louis County, our public health workers now have more time to help with contact tracing, and I expect them to be more engaged in that, as well as the numbers continue to go in the right direction. But I'm sure that our restaurants will continue to cooperate in contacting their patrons or employees who may have been exposed as they have been doing in the past.
Is there anything that restaurant business owners can do to prevent people from using fake names or fake contact information for contact tracing purposes?
So question is about people not using their real names at restaurants. Certainly there has always been a group of people who look at this pandemic as what can I get away with? We ask that folks will look at this response to the pandemic in all business sectors and all walks of their life as to what can I do to be helpful, what can I do to protect myself and others who may have been exposed to the virus and need to know so they can get medical treatment or know how to protect themselves. If someone doesn't want to participate in this process to protect themselves or others who may have been exposed, I do believe that will be a rare event. It's the opinion of our health department that that's a relatively rare event, and I hope we don't see it.
Why is today the day that you're allowing indoor dining to resume?
The question is, why did we choose today? Why did our health department and our public health experts recommend today to relax standards for restrictions on indoor dining? They have looked at CDC guidelines, recommendations from the White House Task Force, information from the Pandemic Task Force here in the St. Louis region, and their own review of cases, case trends, hospitalizations, and other indicators that we've always used, including emerging research on public health trends and how to keep the virus from spreading, and emerging research on medical therapies. And all that information put together gives our public health experts guidance on when it's the right time to relax restrictions on indoor dining in St. Louis County. In addition, they wanted to make sure that our restaurants had time to prepare for taking care of patrons and keeping them safe. And some of these new restrictions required some preparation.
We have one more question for you, Dr. Page. Will restrictions be increased if the metro area sees an increase in cases after the holidays? And when will you make such a determination?
The question is about when would we or how would we make a decision on whether or not to change our current restrictions one way or the other, either more restrictive or less. And we will continue to depend on our experts in the Department of Public Health to give us that guidance, to review the data, the numbers, the percentage of positives, the trends in cases in our community, the availability of testing, and hospitalizations. All of the data that we've looked at in the past, ICU capacity, hospital admission trends, whether those are going in the right direction or the wrong direction, and also a new trend that we have in our community now, and that's vaccine availability and the vaccine rollout. That will be a part of our health department's decision as well. And we'll also be monitoring, as always, new research that becomes available on the best way to protect people from the spread of the virus in our community. And if those trends are going in the wrong direction, then we will certainly be considering more restrictions. But we make all of our decisions in the Department of Public Health based on a 7-day average, and don't make our decisions on a one-day spike one way or the other. Any other questions?
That's all I have for you.
Okay, thank you.